Okay, part 4, dementia and Alzheimer's disease, more specific details of these. So this is what we're going to connect. We're going to start to go over dementia. So we're specifically talking about dementia now. So here's what happens over a period of time. This is going to be more like Alzheimer's disease. So you can see here, this is a graph. It describes what these things are right here. So first thing we have is this yellow is amyloid-beta plaque. That's those little sponge things, right? So you can see what happens over a period of time. You see this is normal. You have normal brain function. Then here you have mild cognitive impairment. So this right here can take decades of your brain being inflamed, you developing amyloid-beta plaques, and these tau proteins in here can take decades and decades, and then you start to get memory problems. Right here, this right here is the memory right here. This is when you first start to get memory problems, and then over here, then this is what we are classified as dementia. So my point to this slide is this starts decades before you actually have mild cognitive impairment, MCI. So if you're having brain problems, that's telling you that your body's been malfunctioning and inflamed for quite some time. So again, these are the different types of dementia. We kind of went through that. This is a real critical slide. This comes from the Alzheimer's Association. So 10 early signs of dementia/Alzheimer's disease, and this comes right from their website. Memory losses that disrupts daily life. So if you're experiencing these things here, right, forget recent events, dates, challenges planning, difficulty completing tasks at home, confusion with time, place, trouble understanding visual images or spatial images, new problems with words, you can't learn new words, or you have a hard time writing, misplacing things, decreased judgment, withdrawal from social aspects. These are all early signs of dementia, which is basically neurodegeneration. This comes from the Alzheimer's Association, 7 stages of Alzheimer's disease. So if you haven't done anything to protect your brain, most people for sure are going to be in stage 3, and a lot of people are going to be in stage 4. So mild cognitive decline, which is what we call MCI, mild cognitive impairment. Has trouble remembering names when introduced to new people, forgets material that you've just learned, experiences increased problems with learning or organizing things. Now this right here, moderate, so this is mild, right? And this is moderate cognitive decline, early Alzheimer's disease. Again, early Alzheimer's disease, forgets events. This is pretty critical. I'll do this on patients right here. I'll have them count from 100 down by 7. And a lot of people struggle. This 35-year-old man or 34-year-old man, he couldn't do this. He could do it for about, he did it down to in about the 70s, and then he just broke apart and actually couldn't do it. So, if you're having these things, it just tells you, hey, your brain's important. You got to do something. You have difficulty paying bills, and you're forgetting your own personal information. Here, stage 5 is moderately severe decline. You can't remember your address, your phone number, confused what day it is. This right here, 5 to 7 here, are late stage Alzheimer's disease. So, so we really want to catch people like right in here, right? We want people coming in. Hey, what can I do to fix my brain? But of course, most people are going to be coming to us in stage 3, 4, and stage 5 right here. This comes from the Centers for Disease Control, the CDC, about diabetes. It says that 60 to 70% of people with diabetes have mild to severe forms of nervous system damage. The risk for strokes is 2 to 4 times higher among people with diabetes. Diabetes and blood sugar is not your friend. Here it comes from a study, the relationship between Alzheimer's disease and type 3 diabetes. Basically what they're saying is that Alzheimer's disease is now type 3 diabetes. In recent years, Alzheimer's disease, AD, has been considered to be in part neuroendocrine disorder, even referred to as what? Type 3 diabetes, which is blood sugar problems. Why? Because blood sugar problems cause your body to be inflamed. Insulin functions by controlling neurotransmitter release, a process at the synapse when the two neurons come together, activating signaling pathways associated with long-term memory. So, in other words, if you have high insulin levels, you cannot remember things long-term. So what are some labs? Like, how can we determine this? So this is a lady that I talked about. So right here, what we want to see right here is, remember, this is where she started. This is where she was over in a month. And this is the sweet spot. So we want your insulin to be around 5. We want your fasting glucose, but really it's showing between 80 and 85 right now. Okay, so this is the functional range. This is where healthy people live. This is the medical range. So these are some of my labs on patients. So this is an insulin marker. When she first came into me, it was 23. This is huge, right? Bad. What's happening to her brain? It's starting to neurodegenerate. What's happening to her memory? It's starting to go. Her body's chronically inflamed. Her brain's chronically inflamed. Every marker here is where I've rechecked that insulin. And you can see here it's in a sweet spot. Last time we checked it is 4.5. We want this to be less than, do you remember? Less than 5. Okay, less than 5. So we got that. Boom. Here's an A1C. This is a 90-day marker for blood glucose. Every 90 days, your red blood cells die. We want this marker to be 5.2 or less. That's the sweet spot. Okay, that's the sweet spot where we want that. Okay, that's 5.2 or less. She came in, she's 5.3, she's diabetic. After our program, this is every time I check this marker. You can see down here, she was 6.3, now she's down to 5.4. We want this 5.2. Much, much better. What do we do with her brain degeneration? It's stopping it. So we stop the brain degeneration because we decrease her inflammation. Then what we want to do is we want to support those neurons, the fingers, to start to grow longer, right? And start to branch out to other neurons. This is an insulin. This is really, really bad. When she first came in, it was 46. She came in her office diabetic, memory just a disaster. And then we rechecked it. We did some things functionally, and it went down from basically 46 to 14. Now, is it perfect? Nope, it's not perfect, but it's definitely a lot better than what she was. So you need to do the right labs to decrease inflammation and then start growing the neurons. So these are some exercises you can do. If you have short-term memory problems, it usually affects your, what we call your medial temporal lobe, and this is short-term memory, right? So impaired memory, loss of visual memory, altered, now these are some other things in here. Here we go. Memory less efficient, memory loss that impacts daily activities, have a hard time remembering things. So what can we do? Applications here, decrease inflammation, then Lumosity for an app. We want to, let me just erase that stuff here. Like there's an application. This is Lumosity. You can go online. These are brain games. So what are we trying to do? We're trying to exercise your brain. Just like exercising your bicep, right? We're exercising your brain. This is where right here, this is where memory starts to go in that little red thing. So first thing we need to do, we need to do an evaluation. We need to see what part of your brain's not functioning right. We do that with the paperwork. We do that with the exam. Then from there, we're going to take some labs because we want to see how your body's physiology is coming, how your body's inflamed. Is your body inflamed? How much is it inflamed? Are you nutrient deficient? Are you missing nutrients? All these things are scanned through the blood work. Then we get that blood work back. We start working on your body, start decreasing your inflammation. Then we're going to give you your brain exercises, just like exercising your bicep or your muscle. Lumosity is one of these things that you can start to exercise. And when you start to exercise your brain, just like the neuron starts to grow, when you start to exercise and do these exercises, this is when those fingers start to get longer, right? They start to get longer with exercise. They do not get longer with nutrition. Nutrition stops or slows down the inflammation. Then once you slow down the inflammation, then it allows these fingers to start to grow with the correct exercise, right? With the correct exercise. And the nutrients, once you have good nutrients, it will help support the growing of those neurons. I should say that more clearly. All right, so here's some studies. Alpha GPC, this is a supplement that you can get over online. It demonstrates It demonstrates patients with cognitive, with the benefits with cognitive function. Like it helps your brain, okay? It plays an important role in maintaining neurology. In middle-aged elderly adults, this is the name of it, alpha GPC, it helps support memory and proper cognitive function. So these are supplements that you can take. So now we're going to decrease your inflammation, then we're going to give your nutrients, your brain nutrients that actually supports your nervous system. Here's fish oil. Now, this is a very specific type of fish oil. This is what we call DHA. Fish oil has two different things. It has DHA and EPA. Now, people that have brain problems, you want the DHA in surplus. So, the DHA helps support your brain neurology. So we want to start working with DHA. So this is a supplement that you can start to take. Now, how much should you take? I don't know how much you should take. That's why functional medicine is an individualized, custom tailored program to figure out your needs. Here we go. DHA reduces endoplasmic reticulum associated with inflammation. So what does it do? It alters your, remember that microglia? It alters your brain chemistry, your inflammation in your brain. It decreases inflammation in your brain by this big term right there, okay? So DHA treated tissue and reduced neuronal degeneration in DHA treated brains at 3 days, 7 days, and 20 days later of traumatic brain injury. So DHA reduces inflammation and supports your brain. That's a research fact. Galantamine right here. This is another supplement, and there's lots and lots of research on this. 24 milligrams a day is safe and effective long-term treatment to mild to moderate AD, which is Alzheimer's disease. Potential exists for prolonged benefit with galantamine therapy versus lack of treatment alone. So what is this saying? This is saying that this is a supplement that you can take. This actually supports neural chemistry in your brain to start supporting your memory. These are supplements, proven fact that you can do that. How much should you take? I don't know how much you should take. That's why you need to come in and we can sit down, we can figure this stuff out. It's a functional medicine approach. It's a custom tailored plan. So galantamine here, it says 6 to 24 milligrams a day. Significant benefits with cognition, function, behavioral symptoms of attention of Alzheimer's disease as compared with placebo. And this is a big study. This is 978 patients. Okay, that's the end of part 4.